oral presentation assignment on cancer. So I looked at cisplatin. Cisplatin, it's an anti-cancer drug for tumors, mainly ovarian and testicular cancer. It's cell cycle nonspecific. It induces cell cycle arrest. It becomes activated once it enters the cell, which you can see here. In the cytoplasm, chlorine atoms are displaced by water molecules. Cisplatin then binds to N7 reactive centers on the purine residues, and it causes DNA damage in cancer cells, blocking cell division and resulting in cell apoptosis. So you see it entering the cell usually through active diffusion, but sometimes passive. This is the structure. Interactions within the cell causing cell cycle arrest, DNA damage, it's not able to repair, and then apoptosis. So looking at the side effects and history of cisplatin. So cisplatin interacts with the DNA and forms covalent adducts with purine and the platinum compound. This includes cell damaging effects. Mild effects would be nausea, vomiting, decreased blood cell and platelets, decreased response to infection, and then more serious side effects would be nephrotoxy, hepatotoxy, and cardiotoxy. It's also called CDDP. So this is just a visual that kind of talks about what I've talked about. So DNA interactions, signal transduction, which we talked about, drug resistance, which is common of chemo drugs, and then the addition of another substance or treatment to lower the side effects and help the efficacy of the drug. So the history of cisplatin, it was first synthesized by Michel Peyron in 1844. The chemical structure was discovered further by Alfred Werner. Then there was a long period of time where not a whole lot was done with it. It regained scientific interest in the 1960s when they found that the compound prevented E. coli growth. And then its use for human testing for cancer treatment was approved in the US in 1978. So in regards to cancer disparities, so I looked at a couple articles talking about how Black people or African Americans have higher death rates than all other racial or ethnical groups for many types of cancer. So the first paper that I looked at was, both of these papers are from the Journal of Community Health. The first one is a 2013 article called Black Women's Awareness of Breast Cancer Disparity and Perceptions of the Causes of Disparity. So it found that Black women are 62% more likely to die of breast cancer than other ethnicities. In a 2007 study in Chicago, they were talking about how earlier screening, diagnosis, treatment will lead to survival. In a 2017 article, again, the Journal of Community Health, Prostate Knowledge, Beliefs, Attitudes and Beliefs in Black College Men, a qualitative study. They talked about how Black men are twice as likely to die of prostate cancer than white men. And they mentioned how sometimes they found that prostate cancer in Black men was a little bit more aggressive, so earlier screening was necessary and access to treatment to further lower those numbers. So how to overcome this? The factors that influence the cancer disparities are access to care, income, education, and healthcare coverage. And like, how do we overcome this? Some things that I was thinking of are access to healthcare, early screening, low-cost treatment, low-cost medication, actions against racial discrimination within the medical system,